All right, Brian, and doctors are closer to finding the root cause of blood clots that might be linked to AstraZeneca and Johnson and Johnson's vaccines. So joining us now with more on this is our chief health editor, Dr. Partha Nandi. Good afternoon, Dr. Nandi.
Afternoon, Glenda.
So there's a name for this condition. Can you tell us what it is and what the latest findings are regarding these rare blood clots?
As usual, Glenda, there's a long scientific name, and it's being called vaccine-induced immune thrombotic thrombocytopenia, a mouthful, or VITT for short. So we'll go with VITT. The good news is that, we're homing in on the cause of these blood clots. Scientists studied 22 patients who developed this VITT after getting AstraZeneca's vaccine. And what they noticed was that the vaccine appeared to ignite a very unusual and intense immune reaction. Now, everyone, right, all of us, you and I, have platelets in our bodies that help to heal wounds by forming clots, right? What researchers found that in the immune system of these patients, they actually created antibodies against platelet factor 4, and this likely caused the platelets to clump together in the blood, causing uncontrolled clotting. And in addition to this, Glenda, some of these patients also suffered hemorrhaging and severe bleeding. So now these findings are not final, and they're mostly linked to the AstraZeneca vaccine. But since Johnson and Johnson's vaccine also uses what's called an adenovirus, a common cold virus, it's possible that this unusual immune reaction may also be linked to Johnson and Johnson's blood clots as well.
So these findings are very helpful, Doc. I mean, even when it comes to treating the condition, regardless of whether vaccines are causing it or not.
Absolutely. I think these findings are critical. And why? Because this type of antibody response, we've seen this before as a rare reaction to a drug called heparin. Now, heparin, many of you may know, is a very common blood thinner, right? Used, and we prescribe it for blood clots. So it's imperative that heparin is not used as a treatment for this new condition called VITT. If vaccines are found to be causing VITT, then patients have to be treated with another anti-clotting drug and possibly intravenous immunoglobulin. Now, what that does, it's a blood product that may replace the depleted platelets and the reaction that you're getting. I'd also like to stress two things. First, this condition has not, I say not, been linked to the Pfizer or Moderna COVID-19 vaccine. So we've got two really good choices. They're made with a different technology. And second, if this new condition is found to be caused by AstraZeneca or Johnson & Johnson's vaccine, it's a very rare and unusual reaction. Why am I saying that? I still really, really, really ask folks to get vaccinated and get protected, because that's how we're going to get past this and get past what we've been going through for the last year plus.
All right, Dr. Nandi, thank you so much for the update.